The one big beautiful bill is being sold as a budget fix, but in reality, it's a legislative time bomb. And rural hospitals are the first target. So Louisiana's medical leaders are sounding the alarm. This bill will cut Medicaid funding by 20%. And that alone could force nearly half of the state's rural hospitals to shut down. And Louisiana isn't alone. States like Kentucky, Pennsylvania, Michigan, Ohio, and even California are next in line. Why? Because this bill hits Medicaid expansion states the hardest, slashing up to 119 billion in rural funding nationwide. These hospitals are already operating on razor thin margins. This bill doesn't trim fat, it amputates care. Let me be clear, this is not just a healthcare issue, it's a political blueprint. By slashing funding in the places that rely most on public healthcare and pretending it's about fiscal responsibility, lawmakers are trying to privatize survival. They know what happens when your local hospital closes. You don't just lose care, you lose jobs, you lose stability, you lose the ability to fight back. And the proposed fix, 25 billion rural relief fund. It sounds nice until you realize the total cuts are projected to be 3 times that. It's like setting your house on fire and then handing you a hose, a garden hose. This bill is a disaster, and Louisiana is just the first visible crack in a system they're trying to collapse on purpose. This bill doesn't cut waste, it cuts lifelines. If you live in a rural area or if your hospital relies on Medicaid, you should be very worried. And you should be calling your senators like yesterday. Okay?